All right, good morning, everyone. Thank you so much for having me. I'm thrilled to be here sharing some more information with you all about Unite Us, about Unite Massachusetts, really zooming out and exploring who we are and the work that we're doing in our community throughout Massachusetts. Like Claire shared, my name is Arianna Weatherley. I'm the Senior Community Engagement Manager with Unite Us, supporting the Unite Massachusetts network. Prior to my work here at Unite Us, I was in the nonprofit space, so I was a child advocacy director and did many years in the field of direct service, primarily working with youth and families, navigation to care, program development for quite some time. So I'm very familiar with a lot of the barriers and ups and downs that goes through that process. And I'm also born and raised in our beautiful Bay State of Massachusetts, so live in the southeast part of the state here, and really engage with community-based organizations, nonprofits, and really, building out the network, which we will dive into. If at any time we're moving through the content today, you have questions, you want to know more, something that's more specific for your workflow and your environment, please feel free to utilize that chat box. I'm not sure the functionalities if you can raise your hand or unmute yourself, but all are welcome to kind of jump in and share. I want to make sure you get the information that you're looking for as we get started this morning. So as I jump right in covering our agenda, really, again, my goal is to chat about, what is Unite Us? What is Unite Massachusetts? What's the difference there? Really narrowing in on that coordination of care and our values and the work that we're doing, providing that measurable impact and sharing a little more information in that space, and then next steps and how to get involved and what that might look like for your organization and your workflow. So before I jump right into the fun stuff, I'm going to ask Claire to launch our first poll just to get a gauge from the audience to see how much you might already know, kind of where our baseline is in the information that we are looking for.
All right, here you go.
Perfect. And Claire, I'll leave it to you to end it whenever you think is a good time, most appropriate, if you're seeing things come in.
Yeah, it's like I saw the answer come in, so.
Perfect, very little. So how much do you know about Unite Us and our network here in Unite Massachusetts? Very little, that's a great place to start. We're in the right environment to do that, so fantastic as we're moving along, great baseline. Really, when zooming out and thinking about Unite Us, we're really focusing in on this new model of care that's driven by the community, really recognizing that health starts in our communities. How can we build up the amazing and wonderful services that already exist within our communities and really provide that open door access for every single person in our community to access that same level of care. So we're really passionate about that and starting our communities, recognizing each community looks very different from one another, even throughout the state here in Massachusetts, and even the greater Boston area, are vastly different from one another. So really being intentional about the needs of our neighborhoods, the people that we're serving, and how best we can coordinate that care for them. Again, thinking about Unite Us, if you've looked us up online, if you get more curious and you want to Google us, a big thing you're going to see is, connecting health and social care and really focusing in on the social determinants of health. And a lot of conversations I have with organizations throughout the state, sometimes they might say, I don't know if I'm a good fit. We don't do a lot in the healthcare space, or we don't coordinate services, but we're really trying to change that dynamic in that language to really encapsulate health to include both healthcare and social care, right? Recognizing that social care is just as important and makes so much of an impact in the overall health and well-being of an individual as healthcare does. So that's our goal in bringing all of those different pieces together, as we've seen a lot of gaps in services or barriers that hinder individuals from accessing the care they may need. Really zooming out, when I talk about Unite Us and who are we, what is our connection to this work and how we work both in Massachusetts and throughout the country. We are a national company, really starting as a veteran focus. Our two co-founders are veterans. They came back from their time in the military, and as they, were reacclimating back into civilian life, found very quickly how frustrating and fragmented those communication pathways were in trying to access their own care and services, right? So as they were, plugging into different resources they may have needed, realized, no one's communicating with each other. I'm giving the same information a number of times, a multitude of different phone numbers and getting bounced around from place to place, and don't feel like I'm really getting all of my needs met. So they really created Unite Us to streamline those communication pathways and bridge those gaps and, the divide that we see a lot in the silos of communication between healthcare, social care, government agencies, so on and so forth. So like I said, we are a national company in almost all 50 states, really building up these unique coordinated care networks in the heart of communities to really speak to the needs of what are vocalized there by the clients that we're serving and the people that are tapping in and accessing the resources. So throughout the country, we partner with a host of many different organizations. Some of those on the right you can see there are both supporters, funders, organizations that plug in, really utilizing the network to access a wealth of data to speak to the volume of the work that they're doing, really supporting and focused on social determinants of health and how to bridge that gap in the coordination of care. Narrowing in a little bit further, Unite Massachusetts is one of those coordinated care networks. So like I mentioned, I might say Unite Massachusetts, Unite Us quite a bit interchangeably, but I just wanted to clarify here that Unite Massachusetts is one of those coordinated care networks, and providers on the Unite Massachusetts network all utilize the Unite Us tool to send and receive referrals, track outcomes of what's happening with those referrals to clients in the community, and really address the social needs that their clients might be, exhibiting to improve overall health needs from that population. I am excited to share, so a big portion of this as we narrow in more specifically in Massachusetts and a little history there. The network here in Massachusetts started about 5 years ago as we partnered with Brighton Marine in the greater Boston area, really building up a core relationship there and, throughout the greater Boston area, as well as throughout the state, really focusing on veteran and military serving organizations. We quickly shifted over both as a company and here in Massachusetts, recognizing it's not just veterans that struggle with all of those barriers that hinder, access to care, but every single person in our community struggles with those same barriers. So really shifting gears there and onboarding a host of wonderful organizations that serve a number of different populations. So we also partnered about 2 years ago with the ACO in the Merrimack Valley region, so the Merrimack Valley Accountable Care Organization in the greater Lawrence area, and have done a lot of tremendous work throughout that space to partner with their healthcare system, with community-based organizations in that area, as well as nonprofits. And then dove back in even further, cultivating a lot of wonderful coordination and communication pathways and partnerships with SSOs and nonprofits throughout the greater Boston area and beyond. So the state of the Massachusetts network right now is really thriving, really robust throughout greater Boston, the Merrimack Valley region, parts of Norfolk County, and sprinkled throughout the state from there. We are growing rapidly, to be very robust statewide, but really taking that, investing in our partners and really honing in on what they may need to meet the needs of the clients that they're seeing. One thing I will mention before moving on, and people thinking this, sounds great, and the more she talks about it, I'm excited to learn more. How much is this going to cost me though? Really thrilled to share. It is at no cost for community-based organizations, for nonprofits, for SSOs to plug into the network, utilize all those data capabilities, make outgoing, incoming referrals, and track what's happening with all of those referrals we're making into the network. It is at no cost, which is so exciting coming from the nonprofit space myself. As I shared, this was a huge, exciting piece for me, as data was a huge component of some of the work that I did. The reason behind this is because of our wonderful supporters and our funders here in Massachusetts and throughout the nation. So the ACO in the Merrimack Valley region are a huge supporter in funding that Massachusetts network. And I just wanted to also mention, that is our business model. It will always be our business model, because we really know the heart of the tremendous work being done in the community is from nonprofits, from SSOs and CBOs in the space. And we want to ensure that that doesn't change for people to gain access. Before moving on even further and getting deeper into the data, some more specifics on Massachusetts, I just want to pause to see if we have any questions thus far. It's all right if we don't. I sometimes love it because I'm doing a great job articulating the information then. One thing I also wanted to highlight when building up these coordinated care networks, specifically even, looking at Massachusetts and doing that work and nurturing those partnerships, really being intentional and looking at health equity in our communities and making that a priority as we build up that network and the work that we do at Unite Us. One thing I really wanted to highlight in this slide is how out of the box and creative we really try to be, and thinking, where is that community really plugging in? Where might they be vocalizing need? How can we connect them in a space that they already feel safe, trusted, in an environment that they can plug in without adding additional barriers or steps that hinder them from getting the care that they need? So I will jump into this more, but really wanted to highlight that. And when we think of health and social service care, really, thinking outside the box and getting creative of partners that we'll see on the network, from things like a barbershop or houses of worship, when we're thinking about faith-based organizations and how much of a staple that is in certain communities throughout Massachusetts. So really wanted to highlight that we're stepping away from just the basic needs, although very important. We see those highlighted in the network, but throughout all of the different service types on the network to refer for partners, we have, well over 140 different service types on there to really get specific on where we're connecting clients to gain access to the help that they actually need. I love this slide, very colorful, very bold, but it's a wonderful illustration to give a highlight of the Massachusetts network that we are continuing to grow and build here throughout the state. So the Unite Massachusetts network, all of the logos that you see here on this slide are represented in the network. They're active, have the ability to send and receive referrals for their different programs. There are many more than the logos that you see on this slide. This is just a snapshot of what I could fit on here, but there are many more. And I really love to do this to illustrate, again, the different types of services we can find throughout the network, from food insecurity to workforce development. Education is a huge one. Individual family support we see sprinkled throughout. Substance use. The more I look at this slide, the more I'm, just really excited to see even a different service type that maybe we didn't know existed, or we didn't know we had the capability to connect some of our clients to. So I love to highlight this in illustrating, the vast range of different care that we're able to provide those wraparound services to clients. All right, so I would love to take a moment here if anyone wants to share in the chat, or any other form that you feel comfortable. When thinking about traditional referral pathways, how do you currently, receive referrals? What are some barriers that you're seeing now as you're making those referrals for clients, or maybe even on the receiving end for those? I'll pause. If no one wants to share, that's all right too. I'll just keep going, but I love to offer the space if anyone wants to share. All right, so if you are excited and get motivated as we keep going, don't be shy. Please jump in at any time. But I'd love to highlight on this slide when we're thinking about traditional pathways in making referrals, receiving referrals, really coordinating that care for individuals. What we traditionally see is this diagram on the left, right? We have our client here. She is getting connected to a bunch of different services in the community. She's also connected to different services that are provided through government entities. And then she's also connecting in healthcare. All of these different branches are not connected. They're very siloed. So there's a lot of duplicative data that's continually being captured. And unfortunately, that burden is being, left on the client to contact all of these individuals, share that same information over and over and over again. And really having that lack of visibility throughout that client journey for the client. So the goal in utilizing the network to coordinate care for individuals is really to equip all of these wonderful partners throughout our network to highlight that collaboration throughout all of the different service sectors, between healthcare, between government, within the community, really being trauma informed and putting the client at the center so they can share their need one time and get connected with a wealth of resources beyond what might be available in the place that they're sharing. For instance, I don't know about you, speaking from my case management experience, and again, I worked in the field of trauma, so did a lot of crisis management, and I would see clients who would identify a crisis or they were coming into my office for a particular situation, and rarely, I don't think ever, I had a client that, through even that 5-minute initial conversation had one need only. If we were able to solve that, then everything would be great. There was usually, 5 or 6 co-occurring needs compounded with the crisis that we were dealing with. And unfortunately, at my organization, we didn't have the capacity to be everything to everyone, and would make a lot of outgoing referrals for clients. And, also not having the capacity to do the follow-up that I really wish I did have in connecting those clients to care, and left them with phone numbers and pamphlets to say, here's who might be able to help you with this food insecurity need, or, your housing situation, or, navigating your benefits information. So unfortunately, that burden, fell back on that client, and they were left really overwhelmed in trying to navigate that process by themselves. So really putting the client at the center is something I'm very passionate about from my work in trauma, as we're limiting the number of times a client needs to share their information to get connected to all of these different pieces of the puzzle. And from the provider's perspective, to have visibility into that client journey, to see, where are they already being referred? Did they get connected or access services, for food already, for benefits? And most excitingly, tracking the true outcomes of what's happening with all of those referrals sent throughout the network, which I will share because that is something I was like mind blown about in doing my work at Unite Us, and thinking I make so many referrals for clients day in and day out. I never know what happens with them. I hope they made it. I hope it was successful in what they were able to do. Unfortunately, found them coming back 3 months, 6 months later. We were starting over in that referral pathway process. So really being able to track the outcomes and seeing, if those referrals were being resolved, unresolved, why is that? Really speaking to the needs of what my community was expressing their barriers were. So one thing I'd love to highlight here, and jumping in as we look at this coordination of care and really centralizing all of that information with the client at the center, we're really able to then drive those outcomes, again, of what's happening with them, and telling a story with data, with the work that's already being done at your organizations. So there's already tremendous work being done, amazing connections being made by community health workers, those that are, living in the community, maybe just doing intakes. so much communication and referrals are being made day in and day out and not truly being captured in a tangible way where we can visualize and tell a story with that data to highlight those programs or the work that you're doing at your organization. So I love to use this example from a housing organization in Kentucky that's on the network to really drive some illustration to the data that they're able to capture. So in this example right here, we do have this housing agency. They are on the network. They have different programs at their agency that they're able to receive referrals from other providers in the network. They also have what we call an assistance request form, which is essentially a client inquiry form. So if a client wanted to go on their website and refer themselves, they heard about them somehow, and they want to get connected, all possible as well. So that's a different access point they have to connect to clients as well. And then internal cases, which are cases that they weren't referred by anybody, but maybe they got a phone call and they're able to serve that client and have the programs that they're looking for. So right off the bat, we can capture immediately how many, get a great visualization into how many of these referrals are coming from other providers that we're working with throughout the community. Maybe it's a certain service type we're seeing most of our referrals coming from. How many of those referrals are clients that are self-referring, that are doing their own research and find us and are reaching out asking for help? And then again, how many might be calling? So breaking down even where the referrals are coming from is exciting, but then being able to assess what the actual needs of these clients are and the resolution rates of what that might look like. So in this particular example, utilizing those numbers on clients on the left, we're able to see that 81% of clients' needs were resolved in the field of rental and mortgage payment assistance. Resolution of 60%, in housing mediation and eviction prevention. Even further, those percentages on the right-hand side, narrowing down all of those different co-occurring needs that clients identify with, and having that data and information to say, 87% of the food needs that we're, connecting clients to were resolved. 13% were not, and here's why. I love the unresolved data to see why are clients not getting connected? What are those additional barriers we're not seeing? And how can we maybe do something to help that? Wanted to touch point here as we're kind of really taking a step back and thinking of it as more of this coordination of care rather than referrals. Because in that siloed approach, traditionally, when we're faxing, I know I had my resource binder that lived religiously at my desk, and I would access it multiple times a day, and unfortunately would be out of date, or, I'm sure we've all been there with what happens with the resource binder experience. But really moving away from that siloed information piece as we're, again, putting the client at the center and coordinating care for them around there that taps into all of those co-occurring needs to ultimately, drive an increase in a positive direction for health outcomes for them, right? So if they're saying, I have food and housing, but I also lost my job and I can't secure my housing until I find a new job, we want to plug them in with all of those different touch points to set them up for success and move away from that burden being on them, but also that Band-Aid fix where you need food, here's some food, and then we're dealing with that same issue moving forward. So really highlighting that piece of coordination. I know we are a small group, so if people want to jump in and share, that's fantastic. I would love to hear, even if there's keywords that stand out for people when thinking about coordinating care for individuals or making those referrals. What are some of the barriers you all experience when trying to support clients? And if, again, a follow-up to that, if there were additional resources to help equip you in supporting those clients, what might those be? So as I leave space here, if people want to utilize the chat to jump in some keywords or different barriers that might stick out for them. Speaking from my experience, I know a barrier for me oftentimes was transportation or maybe they, didn't have a phone or internet access, you name it. There was all sorts of barriers that were hindering them in trying to support clients and getting them access to the care that they needed. I think a big one too, I love to touch point on, especially in Massachusetts, and both providing a lot of care and services throughout our state, as well as receiving care and services in Massachusetts, how challenging and just an interesting dynamic in thinking about data and data sharing, and having that siloed of not even recognizing, what might be available to me beyond what I can search via Google. There's so many wonderful organizations. And as I continue to outreach and meet with organizations every single day throughout Massachusetts, all of the different service types and what they're able to provide, as well as their catchment area for where they're able to provide these services, is immense, right? So many out there that I didn't even know existed, let alone I could have accessed myself or connected clients to, that maybe being very close-knit in the communities of Massachusetts, knowing and being really comfortable with these 10 to 15 organizations that I refer to a lot, really kind of zooming out to see what else is out there that might be a better fit for my client, that meets their eligibility needs and requirements, and might fit better with their schedule or accessibility with their barriers in terms of childcare or transportation. But barriers are always a big one that we're trying to break down or minimize for that clients to actually get connected to the care that they need. So before I jump more into even the exciting data, I want to pause for questions to see if anyone has any questions, because I can talk about data all day long.
It looks like you do have a question from an anonymous attendee.
Excellent. Yes. So is there more than one Mass Health ACO involved? There is just the Merrimack Valley Accountable Care Organization that's involved right now. We are certainly, exploring many wonderful conversations throughout the state if we can. Are there any hospital systems? Do you find that systems not interested because are not interested because they're doing their own and don't want to collaborate across networks? Absolutely. So I think it's really determined by organizations and their workflow, and really trying to get an idea for how things have been done for such a long time. Things have worked well for some organizations, and really breaking down that routine of the work that's being done. I will say, as I explore more into the data, one thing I really love to highlight as organizations plug into the network is that it is very malleable to organizations and their workflows. And what I mean by that is there's no cookie cutter fit to, when you join the network, you have to do X, Y, and Z. It can look very different for every organization, depending on what that workflow looks like for them. And to complement the work that's being done. The last thing I ever want to do is create additional work for organizations, their staff. So really being intentional as I work with organizations and chat through workflow possibilities to say, you might have 20 programs at your organization, but maybe you only want to put 2 on that accept referrals because you already are really, at capacity over here. My favorite function in the platform is to turn on and off incoming referrals in live time on the network. So this one comes up a lot, especially when thinking about housing services. Let's say there's a shelter, they have 3 beds in the morning. By 1 o'clock in the afternoon, they don't have any beds anymore. Great. We want to shut off those incoming referrals because we don't want clients to spend all of that time getting connected to places that might not be able to work with them. And then just on that last note for that question, any hospital systems, we do very closely work with Lawrence General Hospital, and kind of touching on the FQHC question as well, the Greater Lawrence GLFHC, Greater Lawrence Family Health Center, which is an FQHC, and throughout the country are very, very involved with many hospital systems with a lot of FQHCs, and can certainly provide additional follow-up information on those moving forward. And then looking at the second half of that question, other FQHCs involved, and will the new CBHC be involved? Can you elaborate a little bit on what CBHC is? The Community Behavioral Health Care. Gotcha. Thank you. So the new community behavioral health centers under the state behavioral health roadmap. We've definitely explored those as well. So there's none involved at this moment, but I certainly use those and have had some wonderful conversations with those throughout the state. I can also send in my follow-up information that I will provide to Claire with the slides, with additional resources, those that are more focused on FQHCs, as well as the community health centers, if that would be of interest to the group, because we certainly do a lot of partnerships with them. Excellent. So please jump in with more questions as we keep going. I love the questions. As we jump into just the measurable impact and thinking about data. Oh, I did see one coming about HIPAA. Business associate, yes. So I will jump in because I definitely have a lot of great talking points. So we'll get there. And thinking about privacy and security, we absolutely prioritize that above and beyond. So I can speak to that in just a little bit. As we are looking at the data, some things I really want to highlight in looking at the data is how much of an impact it makes in different areas. So number one, saving time. This is a conversation that comes up a lot in my workflow conversations with CBOs and SSOs, and thinking through how can we change the work, the workflow or the management internally. Again, because not wanting to create duplicative work for individuals and programs, and what that might look like. So really wanted to highlight here is how, studies we have done. I think we even did a study in Philadelphia, in Pittsburgh, where we were able to see that it saved an average of 15 hours per week per case manager. And by utilizing the network to send and receive referrals, because we're cutting out so much of, number one, that follow-up time. So as we're making referrals for clients, we're connecting them places, and then left with, did you get connected? I don't know. I'm trying to get in touch with the client again. They're not calling back. I have a really hard time getting in touch with the case manager where I sent it to see if they even went there. So all of that time that's eaten up by that, as well as finding this resource to even send them to begin with. So again, like I said, my favorite feature is turning on and off incoming referrals, because I can't tell you the number of times I would use my resource binder. I would make a lot of referrals. I would spend time calling and getting to the bottom of it just to learn that, it was a seasonal program, or they're at capacity, so they're not taking anyone else on. And we were kind of starting back at the beginning. So love to highlight that when people are thinking of the impact it might have in their change management systems for their teams, and that it really does make an impact in saving time, as we're truly able to track those outcomes and pull all of the data to see what's happening with all of those referrals. Enhancing care, right? So much like I've pointed on throughout a lot of the conversation today, is really getting that individual connected to the right service faster, in a way that's more trackable, to increase positive health outcomes for them. So we're able to kind of see what's possible beyond our four walls. So we can do X, Y, and Z at our organization in our four walls, but beyond that, really losing visibility into what's happening with that client and how those needs are being met and where they're getting connected. So really having that visibility into the client journey, overall enhancing the care for the client, which, is very important. Last but not least, leveraging all of the additional data, insights, the additional resources able to share for a host of different reasons. So organizations completely own their data. They're able to do what they'd like with that. I will get a little bit more into data as well in the following steps as far as what we can, what we do provide and what you're able to see. But I will say a lot of organizations use these in different and creative ways. One thing that I was really excited in plugging into Unite Us from my nonprofit space was, as I was doing a lot of grant reporting, quarterly, doing different board meetings and having to report on different things for the programs that I was overseeing and developing, and not having tangible data to be able to express the work that I was doing. So a lot of times those grants would say, how many referrals were made to counseling, how many people actually went, did they get X, Y, and Z? And a lot of that information, unfortunately, was anecdotal because it was really hard to capture for both myself and my team, all of the referrals that being made, because in the course of a day, I would have 50 conversations and tell people, try this place, this one might be able to help you, and never was really being able to capture that in a space. So being able to pull that for grant reporting, people have used it to really show insight into the needs that their community is seeing, and secure additional funding to get a new program, because they're saying that the second highest co-occurring need of their clients is food insecurity, and they want to make sure that they provide something and incorporate that in their program. So really exciting stuff that organizations have been able to use the data in a really methodical or intentional way for the clients that they're seeing. Furthermore, on the data, like I said, as it's your story, we want organizations to be able to tell it and use that in a number of ways. So we're able to track your organizational activity, really measure the impacts that the work that you're having throughout your community is having, and really be informative as far as the decisions being made in that community. So really being able to see both at a aggregate, de-identifiable lens, the needs that are being identified in the space that we're working, but also in your organization, at the organizational level, at the program level, the different needs that are being identified by the clients that you're seeing, and really informing that, again, for those decisions being made throughout your organization and your program. All right, so beyond what we're able to see as we plug into the network and, as trusted providers are in that space, let's say we're an organization, we're sending referrals, we're also receiving them for a couple of our programs, we're able to see aggregate de-identifiable data, again, at the community level space, as well as more narrowed in specific to my organization. So we're able to capture that raw data, but we also provide one free Tableau license for each organization that plugs into the network after they've sent or received 5 referrals, which happens very, very frequently that happens. But I'm really excited that we now offer that also free for organizations, because gathering these insights, you're able to take, even more of a visual impact into the work that you're doing. So we're loving to highlight it here as far as how we're able to take that meaningful action. We're better able to understand the efficiency of the work being done at the organization. We can really track those metrics in a meaningful way. Streamlining that data and that process, which saves an exorbitant amount of time when looking at different data, and really being able to explore different aspects of the data that maybe organizations haven't had insight into in the past, whether it is a specific population or service type that you're trying to get more granular into exploring the needs that are being met or being sent out. Really exciting to be able to get more granular and extract data from there, as well as the visuals that go alongside that. And of course, boosting that impact with the local partnerships. So we're able to uncover these gaps that might be hindering people from accessing care, as there could be a host of resource overlap. A lot of times duplicative services happen for clients, and we want to be able to capture that. I did a fun transition on this slide. But what I really wanted to highlight here too, especially as you get these follow-up slides when utilizing these data dashboards, especially our health equity dashboard, you're able to see all of these things here where you can really get, again, a deeper dive into a number of different things. We can explore the methods, again, that number 4, in the location. So where these gaps might be happening, exploring things of the clients that we're seeing, both again at a local level, but in the community as well, to see the service area and the service types that you might be frequently seeing. Are there any questions about data, capabilities, different options there? Again, I'm more than happy and excited to meet with organizations individually, explore workflow possibilities, and can certainly get more into that. But before moving into our next bucket, just wanted to clarify anything in the data space. Lovely. So this one, really wanting to just explore our overall end-to-end solution that we provide at Unite Us. So I've been sharing so much about the Unite Us network that we're building and doing a lot of work for here throughout our space, but really as Unite Us, wanting to highlight as we look at that end-to-end solution, both the coordination of services with the next step of then improving those outcomes with our end goal of really being able to provide payments for the impact that CBOs, SSOs are having within their community. So really having a forum then to track down, grants or investments, different funding solutions when working with different foundations, and really having that capability to then pay community-based organizations for the services that they're providing. We haven't seen this, and we're moving in this direction in Massachusetts. I will certainly send some follow-up information because we have some really great ways that our networks have done this in different states throughout the country where this is really happening, but really wanted to share it because I think it's so exciting, again, that we're recognizing social services just as an important piece of the puzzle as healthcare in that wraparound well-being for individuals. All right, now kind of pivoting into the privacy, security, all of those wonderful things. I know that was a question that was asked earlier, so I want to make sure I spend some time here. It is our number 1 priority. We very much prioritize that over everything. Like I mentioned, coming from the trauma space, I asked a lot of questions about privacy and security and HIPAA and what that meant for clients as we came in. And I'm really confident and excited to share how much we really do prioritize this in the network and how we're coordinating care. So first and foremost, we never share client data without consent. So before any referral is sent through the network, we do capture consent from that client to have that referral sent. It is available in over 50 languages, and we have 6 different ways in which we can capture that consent. That was exciting for me in my nonprofit life. That was one of the biggest barriers to getting people connected to care, especially working with youth, is really limited in getting that consent signed, and sometimes, taking weeks for getting that consent signed by the guardian, by the parent, and really slowing down the process and getting that person connected to care. So really thrilled that we have 6 ways that we're able to capture that consent. It is an event-based consent, so they are consenting to having that referral sent through the network. If there's an additional layer of consent that is needed by the receiving organization or your organization, we do always encourage those organizations to capture that consent as well, because we want to make sure all of that is in place. We are the next thing in thinking about sensitive information and what that might look like. As I mentioned before, we have over 140 different service types throughout the network. Included in those are a host of what we call sensitive service types. And there's even added layers of protection and privacy that encapsulate those service types. So when we're thinking about substance use, mental behavioral health, domestic violence survivors, so on and so forth. There are added layers of protection and privacy there in thinking of that referral or that client journey for that client. We are HIPAA compliant, high trust certified, SOC 2 type 2, FERPA, 42 CFR, all of the wonderful acronyms that become quite a mouthful, and undergo, penetration testing, really being mindful of those and staying up to date to be the most secure and private as possible. So I'm happy to, again, in the follow-up information, provide some additional information on privacy and security and what that looks like and how, that might play in. I know that's always a really big one, so I want to make sure I highlight it here and pause to see if anyone has questions about this. If there's any follow-up questions, I know someone asked about HIPAA earlier. Excellent. If anything comes up, feel free to utilize the button. But I will include that in the follow-up information that goes out to everybody following our presentation.
Well, it looks like we have a hand up.
Are you a business associate? Great question. So we do a lot with BAAs, and depending on, we also capture that as well. So if joining the network, some organizations might be a covered entity, excuse me, the word escaped me. So if you are a covered entity, we capture that BAA agreement as well, and go through all of the different processes for that. So I will launch these next, I know there's 2 polls, very brief, very high level. So if you want to launch the second one, Claire, that would be really helpful. Just trying to gauge where we started to where we might be now in terms of the information that you might have. Oh, perfect. Excellent. Okay, so we moved up. So I'm doing something right and getting some information out there. And then I will wait on the second poll, because the one thing I did want to mention as far as next steps, what does this look like? There's a lot of information I shared today and a lot of thoughts that you might be having about, like, okay, how might my organization plug into this, or the work that I do fit in, if it makes sense. So wanted to highlight here the number of different options of how to even learn more. Again, these slides will go out to everybody, and I've linked everything in here, so you can always access it at any time. But I did like to mention, I am happy to schedule workflow conversations with individuals if you have more questions specific to your service type, your workflow or programs, and how might this fit in terms of a partnership. Happy to explore that conversation with you, as well as walk through a demonstration. I'm a very visual learner, so I'd be really thrilled to walk through a demonstration of what that could actually look like for you, and giving some examples, some case examples, and having that. The only thing needed to join the network is a registration form. So we try to make it as painless as possible. And that is the only thing. Again, if you're a covered entity, we typically reach out with that BAA agreement. But that's the only thing needed if wanting to plug in and what that looks like. I we do have different trainings. We offer a myriad of support in the network. You will see me quite a bit if you do plug in, because I do a lot throughout our state here in Massachusetts. We do offer a lot of support. But one thing I wanted to mention is I do host a number of events a month. And I linked our events page here, where I will, give a demonstration of the network, different service types that might, plug in and how it works. So everyone's welcome to those and attend one as well. Or maybe you learned something here and you're like, oh, I want to learn more, or I know somebody that might want to learn more about this. You're always welcome to share any and all of this information with them. And then becoming a network champion, which is always fantastic as we work with partners throughout the network, and really utilizing what that might look like for their space. There's so many wonderful providers in the network that utilize that are happy to have that conversation with you, or share, how it works for them and what that looks like. I know we have some really great providers on the network that love to do that and chat with other members. All right, so as Claire launches that last poll and just kind of, again, gauging how our audience is feeling from all the information that I shared, the last thing I do want to also express is, yes, we do offer a lot of training, but it is not we really are passionate about building our community, that relationship within our community and partners there. So I do a lot of wonderful events throughout the community, whether it's a networking event. I do a lot of partner, spotlighting events. If there's new programs, new services that are being offered, and an organization really wants to highlight that with other providers throughout the state. So really engaging in that space as well, where you don't kind of join and fall off. We really do our best to keep everyone engaged as much as you'd like to be. There's no prerequisite there that you have to go to all these things, but we are excited to kind of build up that community for the network as well. And did you launch that last one, Claire? I don't know.
Right now, hang on.
Oh, fabulous.
I think it's up now.
All right, so this one's just helpful for me in thinking through how everyone might be feeling. Like I mentioned before, happy to meet with anyone and everyone and teams to chat through individual workflow and see, kind of where everyone might be in terms of their thought process for next steps.
I'm not seeing anybody responding to this, so maybe they just need to think about it more.
No problem. And that's quite all right as well. We are making perfect time today. So as you do think about it, please know that all of the options are linked on this slide. There's different links throughout the slide. I think even I have my next slide with more of my information on there. So as you continue to process, think about it, gain that follow-up information that Claire's going to send out with a host of resources that I connect with. Really happy to do that. Someone had mentioned looking forward to publicizing to my HHS SGOH clients. Fantastic. We also, as I mentioned before, thinking about the AnyDoor approach and seeing as the network is provider to provider facing and providers are plugging in and making referrals for clients, having that client touch point is really important. So you can always access on the Unite Massachusetts page our Get Help button, any client at any time. I know I walk around Boston, throughout all different areas of Massachusetts, and have like a QR code that I hand out to people because you never know when someone might need help with someone or where they feel safe and secure vocalizing the services that they may need. So that's always available to them. And I will make sure that is also in the follow-up information. So you're happy to share that link with folks if you'd like to. All right, so everyone has my contact information. Please feel free to reach out to me at any time with additional questions. I'm so grateful that you had me here today and asked really amazing questions that were thoughtful and really wonderful to the work that we're doing. Again, I will send out a lot of information. So if additional questions come up after reading all of those, please don't be shy. Feel free to reach out at any time. And I sincerely look forward to meeting with individuals one-on-one and chatting through the specific work that you all are doing in the community.
Great, thank you. Thanks everyone for attending today. We'll be sending out further information, so keep an eye out for that, and have a great rest of your week.